And we appreciate everybody joining us today. When the pandemic first started, our board reached out to staff and said, what can we do when it comes to COVID-19 relief and response? And they approved a great investment for community partnerships and grants to help alleviate some of the pains that our communities were facing and are continue to face because of COVID-19. And we hope that this finds you and your family really safe and healthy. But as the pandemic has worn on, the federal government has stepped in a really big way to offer tremendous support through the initial CARES Act funding that has already been dispersed and that we see making a tremendous impact in our communities. And most recently through the American Rescue Plan Act, or ARPA. A tremendous amount of investments coming into the state of Arizona to the tune of $12 billion to state agencies, counties, and cities where we all live, work, and play. And now we have to think strategically about how to influence those government institutions and make lasting impact with this one-time infusion of funding. So our board at Vitalyst really challenged us to do what we can to influence that funding through government entities, all within what we call the elements of a healthy community, recognizing that health is more than just health care, and we should be looking at all of the social determinants of health, as well as with an intersection of a health equity lens, because we know that inequities in our society, and especially in health and access to health care, have been exposed because of the pandemic. So now we're really trying to reach out to you, to Arizonans from throughout the state, to get your input and insights into how we can shape how government utilizes this one-time infusion of funding through the American Rescue Plan. And that's where we're at now. Vitalyst is really proud to partner with the Arizona Town Hall, not only for the Creating Vibrant Communities Town Hall that has been happening through community town halls throughout the past almost 2 years now, but now in this special project to get community input so that we can compile that information and share it with government institutions and throughout the state to try to inform how the funding can be best utilized. I'm joined by the amazing team at Arizona Town Hall. Tara Jackson is on the line, and today's session will be facilitated by the amazing Pat Norris. So I'll turn it over to her to start today's session.
David, thank you very much. And don't forget, I will send you that check for that compliment. Okay, so the check is in the mail, or will be in the mail. Seriously, ladies and gentlemen, thank you very much for being here. It's a pleasure to see you all for this session. We have prepared 2 questions today to use your time wisely. And I'd like to I'll explain the questions in a moment, but I'd like to explain how we're going to have this conversation, because we really do want to hear from you and your ideas on where the American Rescue Plan Act money should be spent. As I said, we have 2 questions. We'll spend about 20 minutes, 25 minutes on each question. And then as we have that conversation, Mary Greer, who I will ask Mary to wave, will be taking down, noting what you have to say and synthesizing it. And that's a hard job. So I want to make sure I thank Mary in advance at the beginning of the program for doing the heavy lifting in bringing together your thoughts and your observations on where these monies should go. The key here is to listen to what everyone says. Now, we want to get everyone's ideas and thoughts, but if you have a consensus in this room, such as you strongly believe as a group that money should go to, for example, transitional housing, or to avoid evictions, given that the moratorium has expired yesterday, in fact, or on the 30th. If we say that as a group, Mary will note that, and that will be in the report that we as a group reach consensus. But we're not pushing you for consensus. We really want you to explore the ideas and thoughts. And so it's just that where there is consensus in the room, it can be a stronger statement. If you agree with the point that someone has made, I strongly urge you to say thumbs up. And that's why one reason why I encourage you to activate your video if you feel comfortable in doing so. Because then if you'd like to speak, all you have to do is wave your real hand and I'll see it. Now, if you're not comfortable in doing that, you can also put your comment into the chat room, and I'll be monitoring the chat room on my screen, and I'll try and read the comments to the group, so that way your comments are heard by everyone. For those of you who maybe are somewhat new to Zoom, and I bet most of you are not new to Zoom, you can also get in the queue to speak by engaging your Zoom hand. If you go to the bottom of your screen, depending on your device, you'll see an icon that says reactions. If you click on the reaction button, you will see at the bottom of that little window, raise hand. If you click on the raise hand feature, then I will actually see your Zoom hand in your tile, and I'll know that you'd like to speak. I will do my best to call on everyone who raises either their real hand or their Zoom hand. I know that we have Trish on the line by phone, and so every so often, Trish, I'll just call you out to see if you have anything like to say, or if you'd like to say something and you can put it into the chat room, depending on your device, then I'll make sure that we hear from you as well, so we don't ignore you. I'm going to do my best to call on everyone in order that I see their hands. But if you've already spoken and someone else has their hand up who has not yet spoken, I'm going to reserve the right to go out of order and call on that person. That way, everyone will be heard. But I promise you, I'll get back to you. I will not ignore you. So I think those are the basic ways we're going to run this meeting today. Does anyone have any questions about the process, how we're going to have our conversation? Okay, now what I'd like to do is begin with the first question. And let me explain a couple of things. The two questions that we are going to ask you may sound on their face similar, but they really are not at all similar. We sent around, that you should have had a chance to see, the fact sheet that gives you, it's just 2 pages, that recaps the $12 billion that Arizona is going to receive and the very broad categories where it is going to go. So for example, on the second page of the fact sheet, we know that 4.8 billion with a B has been dedicated to direct COVID response and public health measures. 1.7 billion is health-related services and programs. Then 1.2 billion is direct business aid, 1.1 billion human services program and related services. Then approximately 780 million for housing. Then education, 3.5 million. What we're going to, the first question focuses on these very broad categories. And I'm going to be asking you to prioritize those categories. For example, do you think of the categories, the money should really go to housing? That's where the need is the greatest, and that's the priority. Or is it, for example, food, SNAP programs, and the like? So we're going to be talking about categories. The second point I'd make is that in setting priorities and what are the most important needs to use these monies, if every need is first, if everything is a priority, nothing is a priority. So I'm going to ask you to really give some hard thinking to what you think are the number 1 and 2 and 3 categories where these monies should be spent. So let me read to you the first question. That way I'll know we're all on the same page. Arizona is in the process of receiving significant one-time, and it is one-time, federal funding, which includes, as David mentioned, the American Rescue Plan Act and its $12 billion. What are the most important areas to invest these funds to address disparities in health and well-being? So what are the categories that would be the most important that we should be spending these monies to address disparities in health and well-being? And if you all need to see the question again, Tara very kindly put the question in the chat room, so you don't have to memorize it. Now, don't be shy. I know many of you, and I know that you're not reticent, so feel free. Someone has to be first. Feel free to just launch the discussion.
I would suggest housing.
Luann, thank you. Thank you. Housing. All housing, transitional housing. Do you have a more refined thought?
No, I don't. I just know, especially like you said, the eviction moratorium has been raised. And so I don't know where those pockets need to go to address that. But to me, that's very critical.
In fact, Don in the chat room mentions basic needs, and I can't think of probably a more basic need than housing. So thank you for that comment. Other thoughts, or maybe you may all agree with housing, but other thoughts and priorities, because this is a time for a discussion, and then we can kind of narrow it down as we move through our 25 minutes together. Trish?
Yeah, this is Trish. I'm in agreement with housing.
Thank you.
This is Robert. Are we including homeless populations in housing, or would that be a separate subject?
It can be anything that you would like. This conversation is designed to be creative. I will tell you that the second question that I'm going to ask you to prioritize within the broad categories on a more granular basis, what should be the priorities in the broad categories. So for example, under housing, the 700, I'm going to round it off, 80 million, money can go to mortgage and utility payment assistance. It can also go to low income consumers to pay for drinking and wastewater expenses. It can also go to deal with homeless assistance and supportive services. So within that broad category, there are different categories, and we're going to ask you to prioritize within the broad categories. So I think that's a very good thought. And I think that point should be made, or that question should be raised when we get to the second question.
Thank you.
Thanks, Robert. Other comments, ladies and gentlemen? Then I'd also like to let you know that we have the director of the Arizona Department of Housing, Tom Simplot, who is listening in. Tom has been a great participant in all of these town hall vitalist discussions. So our state leaders are listening to what you all have to say and taking it down. So Tom, thanks for joining us again.
Thank you.
We are witnessing what I hope does not happen, but could happen, which is another surge of COVID. One of the major categories for the proposed use of the ARPA funds, I don't think that's Jill and Joe Biden, so I'm going to ignore the call, okay? So is 4.8 billion for direct COVID response for public health measures. That is a significant category, including vaccination campaigns, monitoring the variant spread, plus investments in water, sewer, and broadband infrastructure. Now, I know that we all live in Phoenix, but broadband is a major issue both in our urban areas, I see Luann nodding, as well as our rural areas. So I would ask you to think about other priorities. Housing clearly is on the mind, it looks like most of you, and indeed, Danielle emphasizes housing assistance in her comment in the chat room as well. But if there's consensus on housing, is there a secondary priority such as direct monies for direct COVID response?
This is Robert again. I would like to discuss the broadband. Broadband is a great subject that if we can help them at all, that'd be great in the rural areas. not just for them to know more about COVID and how COVID's impacting the state, but just basic information, both emergency information, workforce information, find a job, seeking medical attention, all that can only be done with broadband connection. In the rural areas, we do have many reports with the Office of Economic Opportunity where we can see that the broadbands are lacking. So I think that would be a great subject to add.
Robert, thank you very much. The Department of the Treasury has issued preliminary regulations regarding the use of the funds. And one of the areas that they have basically pre-approved is in fact an investment in broadband because of it is so critical to the points or to the areas and to the use you just identified. Seth.
Good afternoon, everyone. Seth Dyson with the City of Surprise. I'm here trying to be in a mostly listening mode, but I have to say a few things. I would echo the broadband comments that Robert brought up. And then in terms of housing, I think we've been talking about that out here in Surprise as well. We echo that need, but I think you've got to break down the different types of housing also. So for us, we happen to run a CAP office, which has been very useful to see who's in demand for the housing services. So I would suggest not only temporary rental assistance, but we need to shore up a rental assistance fund long-term because we just don't have enough units right now. I know there's a lot of money in eviction prevention and rental assistance currently, but we're really afraid of what happens after ARPA. So I just wanted to plant that seed with everyone. And then for us, I think permanent supportive housing is a great solution for more units for this population. So I don't know about all the other spectrums of the housing, but I think prevention and rental assistance is critical. And I think there's already funding coming down from different pots of ARPA for some of that. So I don't know if we need to throw a bunch more at that for ARPA, but long-term prevention, rental assistance, and then for current, short-term, maybe that investment in a permanent supportive housing is a housing component for ARPA, because that's more of a permanent solution, not saying we don't need temporary solutions because of the pandemic, but it'd be nice to put this money towards long-term uses, right? So it's not one and done. Anyway, I'll stop. Thanks.
Seth, thank you very much. Your comment is very certainly right now, as we have seen the moratorium expire and we know that we're going to see evictions, we have transition housing needs, and really for the long term. And indeed, as the fact sheet points out, the monies need to be committed before the end of the year 2024, but they can be expended through the end of the year 2026. And so there is time to actually plan for housing and to really get it out of the ground. Other comments, ladies and gentlemen, other priorities within these broad categories.
I would just like to add on to Seth's comment about the housing, because in terms of more permanent supportive, because I know even though people are at the point where they can't pay now, they also can't pay next month and the month after, et cetera. Our housing, whether it's rental or purchasing a home, our values they're skyrocketing. And I think I just read an article the other day that said something like a single family worker that worked in like a fast food, they would have to work 78 hours a week, something like that, to be able to pay a 1-month mortgage. And that's just not feasible on an ongoing basis. So again, I do agree that I don't know if any of that money can be programmed for long-term, but this is not just a one-time need that is there. It's beyond the current need.
Luann, thank you. Dawn?
Sorry, I was on mute. So, I mean, obviously, when we start to talk about housing and families and stability, we know that there's a job market out there, which is wonderful. But to your point, Luann, does anybody really want to work 78.2 hours just to be able to have a roof? But, what goes hand in hand with that is going to be access to care. We as a United Way went all across Maricopa County, and that was a huge concern So while we put in some of these issues, we need to talk about long-term, just like someone talked about around housing. It's got to be a long-term solution because I can't work 78 hours a week if I don't have childcare. And then what impact does it have to these children? And I think that we need to be transparent and mindful that not all of our families have access to high quality care because it costs. And even if we can provide some stipends or some support around that, if I'm looking for care for 78 hours a week, likely I will need more than one option of care. It may be childcare center, and then it might be grandma, or it might be the lady down the street, or my significant other, or someone else, because our children will be in what we call patch care networks. And then how do we ensure that no matter where that child is during the day, that they have the necessary tools to be successful? So we got to make sure that we are educating individuals that might also be in reality caring for other children and trying to prepare them for school. I think everybody's going to do what they have to try to get them through this point. And I know that when you look at the population of what we call family, friend, and neighbor providers, it's typically that individual in the family or the neighbor that really wants to help somebody out. But how do we ensure that they know what they can be doing during these given times and so forth, when a majority of our children will be in some type of care now with this type of condition, probably longer than ever. I can't imagine when I was a child that I would have been in care of somebody else 78 hours a week. And then how tired our parent must feel when they come home. And what does that mean for our social emotional development amongst the parent and the child, and frustration levels? And then we roll into all kinds of social emotional issues that will come up around domestic violence and so forth. So I think that there's a lot tied to that. And that hence is one of the reasons why I talked about my general statement around basic needs, because that's going to be the foundation that we're going to need to be able to support from one end of the spectrum to the other end to ensure our families are going to be able to come out of this pandemic.
Don, thank you for that comment. I note that, for example, under the 1.1 billion that has been proposed for use with human services programs, that would include paying childcare expenses for workers deemed essential during the pandemic. And I think it's pretty clear that we've seen that the essential workers are not the ones on the top of the food chain. I mean, we're all essential, don't get me wrong, but the essential workers are the ones who are being asked to work these long hours. We need them. We now finally have started to realize how they are so critical to our economy and to our livelihood and to our health and well-being.
Can I ask a point of clarification? So
Yes.
speaking to that, there is this point B under the ARPA fact sheet that says assist workers who have performed essential work during the pandemic with premium pay.
Mhm.
Would that be what is in the 4.8 billion premium pay to essential workers?
If you look on the second page of your fact sheet, the premium pay to essential workers is part of the 4.8 billion as part of direct COVID responses.
Okay.
I think we're just about ready to close out this first question, but I just want to make sure I haven't cut anyone off. Does anyone have an additional comment? So we've had a strong emphasis on housing, not just immediate transitional housing, but also long-term. We've had and that has tied into basic needs that Don just mentioned and discussed.
Hi, Pat. This is Alexandra.
Thank you.
So two things. I think the first that comes to my mind is looking at preschool experiences for children whose parents do not currently meet the income requirements. I love that they're contemplating looking at essential workers as the group of people who could have access to preschool or childcare, and that's great. But we have a large group of children who are not going to be going to preschool, because if you are a parent who has to pay for that out of pocket, that tuition is rather large. And that's what we've been hearing from quite a bit of families. There are options for people to consider, but if you, again, based off of income, you're not going to necessarily qualify for all of those options. So that's one thing. And then the other is looking at some support for those who have mortgages. just reemphasizing what was already stated, it's rather intense to think about how expensive mortgages are nowadays. And throughout the pandemic, there really hasn't been relief in the same manner as there has been for renters. And so working with lenders is great to a certain point. And so I think that's another piece that's important to reemphasize. And then going to the homeless, I would really love to see some money going towards holding human services really responsible for engaging the homeless in their community, with some concrete resources and supports that will help them navigate whatever part of the life journey that they're currently on that has taken them to that situation. My role with the Department of Public Health is to, learn about the different issues that we're seeing across Southwest Maricopa. And unfortunately, homelessness is a huge issue. We have people living in bushes in Gila Bend. We have people riding buses where they have a one-way ticket to somewhere with no real destination. So I would love to see that those are prioritized with funding in Southwest. Thank you.
Well, Alexander, thank you very much for that comment. And some of the points you raised will be pertinent as well to the second question. Danielle, did you have a comment?
No, I just wanted to agree and second that.
Got it. Okay. Well, ladies and gentlemen, I think Alexandra has given us an introduction into our second question when she talks about the priorities involving, for example, the monies that have been allocated to housing. So the second question asks you to prioritize within the categories of what you believe would be the most important, where the money should be spent within a category. So let me read question 2. Consider the specific areas noted in the American Rescue Plan Act. And as I said, they're outlined on the second page of your fact sheet, such as housing assistance, human services, business aid, direct COVID response, education programs and services. What should the priorities be for utilizing this one-time funding in these areas? So for example, under housing assistance, should it be rental as a priority? Mortgage assistance? Should they be maybe divided into 50-50? Should one be prioritized over the other or weighted? What should be the priorities within the categories? Yes, Wally?
I just have a clarifying question, please. On the second page, the categories that are placed, is this what the state of Arizona is proposing, or is this what we have come up with?
This information was obtained from the Joint Legislative Budget Committee,
All
which
right.
is a committee of the state legislature. And this was basically their outline based on legislative input as to how the money would be broadly divided.
All right, thank you. I just needed that clarification where it came from. Thank you.
And again, the question, Tara has put this question in the chat room if you need to see it. You don't have to memorize it. Danielle has very kindly put a comment in the chat room about prioritizing within the housing assistance category. She says, I believe that affordable housing and rental assistance should be prioritized above all. We're hearing all across the state about the extreme lack of affordable housing and the need for rental assistance. There is currently a shortage of 136,000 rental homes that are affordable and available to extremely low income renters. With the expiration of the moratorium, renters everywhere are at increased risk for eviction and need housing and rental assistance to avoid homelessness. And then she has a link to more data about what is going on in Arizona. So Danielle, thank you for that information.
The decision gets harder as you have to narrow it down.
This is hard because, as I said at the beginning of the program, we have so many needs. And the question is, where should we, especially within these categories, where should the focus be? For example, under the direct COVID responses, I mean, keeping in mind this is one-time funding, should we prioritize premium pay for essential workers over the next period, next couple years? Should we prioritize building broadband? Should we prioritize vaccination campaigns right now, at least in 2021? Direct business aid, that's 1.2 billion. Assistance to small businesses and restaurants. What type of assistance? So you can see these are very hard issues that we are wrestling, but that is why we're having these discussions, is so that Vitalis can obtain this information, share it with policymakers as appropriate, and so that we can be heard on where we, the citizens, the people who are involved in these issues and areas, can weigh in.
Well, I know businesses need assistance, but there won't be anyone purchasing services from any businesses if they have nowhere to live and they have no means of purchasing those services or products. So again, my vote would be for anything that is serving the base needs of those in an emergency situation at this point, whether it's rental, mortgage, food, and healthcare assistance.
Luann, thank you. I saw some nods. I don't see any thumbs up, but I see nods around the room on your point. Robert, you had raised earlier some of the issues regarding priorities within certain categories. I think that your comment was an excellent one, and I would encourage you to reiterate it here, because this is the question I think that is designed to highlight that.
The broadband one or the homeless one?
Both, actually, because broadband is actually, broadband kind of pops up twice within these categories, once in direct COVID response, and actually once in education programs. Because as we've all seen in this past 18 months, broadband has been critical to remote learning. And so that the availability of broadband, the availability of that infrastructure crops up both under education programs and services and direct COVID responses.
I think that broadband would be a powerful one for that very reason. Plus, there's a disparity between rural and urban broadband needs. So it hits all the spectrum from the poverty areas to the reservations to the mountains to the cities. Not everybody can afford credible broadband resources when they have schools and schooling assignments, and if they want to go to remote training, they're going to need that ability as well. So I think I would vote for broadband to be my number one.
Robert, thank you. I have Dawn, and then I'm going to call on Ashley.
So what I would like to add is I'm going to echo what Robert said, because broadband is much more than just one area. It is about an inequitable system for most. Our families are being reliant upon that to make their medical appointments. They're being reliant upon about their only means of communication. Most of our individuals don't even get mail anymore. They have to pay their bills online, which then reflects to the same thing we talked about with Luann, is like, if I don't necessarily get my mail and I don't have access to the internet, I have no idea my water bill was due, or I have no idea my electric bill. I mean, all of these things are factors, and we are living in a world where it is critical that everybody has equal access to broadband. I mean, I think that was a COVID keeper. It's like digital inequities around broadband have been around forever. However, we have no choice now but to address them, because we've seen how devastated and what this has meant to individuals within our communities. We saw students sitting outside on the curbs at McDonald's to do homework. We saw individuals not getting their medication when needed because they didn't know how to access. And we're talking about a bigger issue than just getting out devices and making sure there's internet. There has to be a component to how to utilize the internet. It's wonderful to give anybody an opportunity to have access to the technology pieces, but if they don't know how to get an email or how to send an email or how to do a FaceTime or whatsoever, we've defeated the purpose. So I think that when you look at digital inequities, we need to look at it at a very wide perspective that is inclusive of access, inclusive of the actual, equipment itself, and then the ability to support the necessary learning gap that may have occurred for some of our individuals. And I mean, I can use my father as a great example. He was adamant about being online, doing everything online. If I looked at my mother, she'd like, I wouldn't give my bank account over line. During COVID, my aunt had me take 2 hours to grocery shop for her. And I said, you are now ready. Now, all you have to do is go to the store, call the number, and they're going to bring it out to your car. Okay, I said, but we have to pay for it. Well, how are we going to pay for it? I said, well, we'll use your debit card, Aunt Sharon. I mean, she's 80 years old. She's fine. And she's like, oh yeah, no, that ain't happening. And I spent 2.5 hours helping create that grocery list. Ultimately, I paid for them because I wanted to get groceries and she'll repay me back. But I mean, those are pieces that we have to be able to educate. Our times have changed and we have not done a good job as a society to help bring everybody along with us, no matter where they're sitting with their SEC. So I think that's really important to consider. So I'm echoing what Robert said, my number one.
Don, while you were speaking, Danielle was thumbs up in agreement. And I think Ashley was nodding her head vigorously. Ashley, you're next up.
Hi, thank you so much. I absolutely second that as well. Not only is there a disparity with the access to broadband, but that also leaves a gap for technology where technology just catapulted during 2020 that we could use to reach these rural areas and specifically tribal members who are not engaging in already state-funded programs for mental health, substance abuse, sexual assault, domestic violence, all of those programs that are already put in place. Having that sort of leverage of not using technology to streamline and reach these communities, whether it's a iPad center or something where they can all come together and be able to access all of these free and already funded programs that are not being utilized. And the information is really hard to reach these areas. As much as we want to believe that snail mail will still work, at the end of the day, a lot of PO boxes won't accept it if you don't have one, especially if you're in a rural area. I think that sort of disconnect is not doing our programs that we already have in place a dishonor of not being able to reach those communities without having that broadband experience. So I very highly support that as well.
Ashley, thank you. So we've discussed the prioritizing housing, especially during the time of this pandemic, how critical that is to keep people in their homes. We've discussed now the importance of broadband in the building of the infrastructure to try and attack the digital divide, the digital inequity that exists in our county, in our state. Other thoughts of priorities within the categories? Well, while you're mulling, I will make a couple of announcements. Much of what we're discussing today is being addressed by Arizona Town Hall and Vitalist at our statewide and our community town halls we've had. And we're going to be having a statewide conversation regarding how to create vibrant communities, which focuses on the social determinants of health. And the statewide town hall will be in Scottsdale for this year, November 15th through the 17th. It's at the SRP Conference Center, which is very near Skysong. And we're going to be recruiting people from all over the state to address many of the issues we're talking about today, and also to come up with precise, specific recommendations for planning to move the ball forward on addressing these issues. So I would encourage you to look at our Arizona Town Hall website and get more information about the statewide program. And if you can, to join us. We hope it will be in person, but we are prepared to be nimble. And if we have to, we can pivot, but we may well have some online programs as well. So please consider participating in that program. We'd like to hear from you. And it will be November 15th through the 17th. then the questions that we have been discussing today will also be included in a survey that we're going to send you electronically right after this meeting is over. So if you have further thoughts that you would like to share with us about priorities within the categories, that's question 2, or priorities among the categories, that was more question 1, please respond to that survey because we would really like to hear from you. So ladies and gentlemen, any other comments in response to question 2? And I see in the chat room, Alexander, thank you for your comment. Domestic violence housing, including housing for men and their children. Yes. David, then I'm going to turn the program over to you for a wrap up, maybe some concluding remarks, and then we'll see if anyone has any questions or final comments to make.
Sounds great. Thank you so much, Pat, and the entire town hall team. Thank you all so much for a really great conversation about how these funds should be utilized, focusing, of course, in the communities in the West Valley, but we've had conversations like this from communities all across the state, and you're not alone in this. And we definitely look forward to compiling the information. Please complete the survey, and that'll help influence our messaging moving forward, so we can ensure lasting impact for these one-time funds. This won't be the last time you hear from us. As Pat mentioned, there are a lot of great opportunities to stay connected with Vitalyst and Arizona Town Hall. So keep a lookout for those opportunities, and just continue to wish you and your family, friends, safety and health. And I also want to give a special shout out to the director of the State Housing Department, Tom Simplot, who has been fantastic and has hit the ground running in his newish role and participating in these, taking your thoughts and insights in for his role for our State Housing Department. So if there are no other comments or questions, I think we can wrap it up there.
Ladies and gentlemen, any last comments, questions?
Pat,
Yes, sir.
this is Tom, and I'm so sorry I'm not on the video. But this is Tom Simplot, and I just wanted to say thank you for having these town hall discussions, and also just to let folks know that the Department of Housing is having its annual housing forum conference in Tucson, August 18th to the 20th. And one component of that will be 2.5 days of a homeless track, where we will be hearing from homeless providers, cities, counties, nonprofits, and we will be learning what has been going on with regard to creating housing for those who are living on the streets in Arizona. And I encourage all of you to join us. It is free, no charge, but you do have to register. And so if you are interested, please reach out to me. I know Pat has this information as well, and Suzanne has this information at Vitalyst. But we would love to have you join us. Again, no charge, but you do have to register in order to participate in the actual virtual component, which is all about homelessness here in Arizona. So thank you, Pat, for letting me get that plug in, and thank you all. I've been listening intently. I really appreciate it.
And Tom, thanks a lot. I echo what David said. It's been great that you have been participating in these sessions, and we appreciate that. And I would encourage you all to consider registering for the program that Tom just mentioned. It's very important. With that, then I think we'll go ahead and adjourn. I'd like to thank you all for attending this conversation. As you may see from the chat room, housing, which we've discussed, and broadband, which we have discussed, have been discussed front and center in our other sessions. So your thoughts, you are not alone in thinking and prioritizing housing and broadband. So take care all, stay safe. We hope to see you soon.
Thank you.